I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. Welcome to the Neuroscience Education Institute podcast. And today, my guest is Dr. Raj Mago, Clinical Assistant Professor of the Department of Psychiatry at the University of Pennsylvania. And what I'd like to ask you about today is this very important topic about side effects. When it comes to treating patients, particularly patients who may be resistant to treatment, and sometimes you find that a patient finally responds to treatment. However, there might be this myriad of side effects that you might have as a challenge. Can you speak to us first about how you got involved in this type of work and tell us a little bit more about your background?
Thank you, Dr. Siegel, for inviting me to speak about this topic. It's very dear to my heart. I have spent the last 15 years doing research about the identification, assessment, and management of different side effects. I edited a journal related to this and wrote a book about the practical management of side effects. And how I got interested in this is that I was consulting on patients who were difficult to treat, and I was told that they have run out of medication options, that they have quote unquote tried everything. But then when I would interview them or interview their families, I would gradually realize that many of the medications that they had taken, it's not that they failed to respond, it's that they were not able to take them for long enough because they had side effects. Right. So they stopped them prematurely, maybe within 2 or 3 weeks of starting the medication. Or because of side effects, they were not able to take the full dose that was needed. So side effects I began to realize were important. The other thing I also realized as an academic or as a researcher was that if you look at the data of why the outcomes of mental health patients have not been markedly improved despite the introduction of so many medications, is because side effects often lead to non-adherence. So non-adherence to the medication is actually the biggest problem in the use of psychiatric medications. So patients with schizophrenia, for example, 80% of them will stop the medication within a year. Wow. Patients with major depressive disorder, 2/3 of them will stop the medication before the first 6 months are up. So if we could develop strategies by which we can help the patients to stay on their medications for many years, without even the development of new medications, we could really revolutionize the outcomes of psychiatric treatments. The other thing I want people to keep in mind is that if you put yourself in the other person's shoes, you realize that side effects have a tremendous effect on the quality of life.
Right.
So a clinician should not think that side effects is just something that you have to bear, or it's like a price you have to pay. If you want the benefit, well, every medicine has side effects. If we take that attitude, then the patients are going to can and do quote unquote vote with their feet by stopping the medication.
Right.
Now, one important point I want to make is that it's a little bit sad that the reasons why patients stop the medications are often related to side effects which are really not going to harm any organ of their body.
That's
so
interesting.
Typically when the people start on most medications, there are some side effects that can occur within the first 1, 2, 3 weeks. And I call these side effects nuisance side effects. These could be like headache, nausea, tremor, diarrhea, some increase in anxiety, things like this. Certainly they are very bothersome. We definitely want to take them seriously. We want to help the patient to overcome these side effects. But they are not harming any part of the body. I tell my patients a series of things when I start the medicine. I say, these side effects are nuisance side effects. They're not going to harm any organ of the body. They're definitely undesirable. The second thing is that all of these tend to diminish within the first 2-3 weeks. So if we can help the person to support the person in staying on the medication, let's say for 30 days or so, a lot of these side effects will have diminished by that time. So it's very unfortunate that we're losing this medication option early on without good reason.
Right.
And then also the side effects that do persist and that are longer lasting, I have become an evangelist for the idea that for each side effect, clinicians need to be trained to have a series of options. I call it a menu of reasonable options, where you have level 1, level 2, and level 3 strategies. So for management of every side effect. So when a side effect comes up, you have some simple things that you can do to try to mitigate it.
Right.
And then if necessary, a little bit more active measures may be required, which I would call level 2. And sometimes there are certain medicines that are very valuable, let's say, for the patient.
Right.
And a good example of that would be clozapine.
Okay.
So you mentioned patients who are treatment resistant.
Right.
So clozapine is the most important antipsychotic medication for treatment resistant schizophrenia.
Right.
There are no good alternatives to clozapine. If a person is doing well on clozapine and has certain side effects of clozapine, it is not a reasonable option to try to switch them, and therefore sometimes we need level 3 interventions. We may need even more energetic interventions to reduce these side effects so that the person can stay on this medication, which is often life-saving.
Right.
In a way, you can think of this as, an analogy would be if the person was on chemotherapy, for example, right? And they were throwing up because they had chemotherapy. We would not view it as a reasonable option for them to stop the chemotherapy.
Right.
Because it is essential for their treatment. And we would take energetic measures to reduce these side effects. So I think it is absolutely essential that when we train young physicians and nurse practitioners in the practice of psychopharmacology, that they are equally trained in being able to avoid side effects. Sometimes some side effects can be avoided by strategically choosing certain medications. And I have also done original research of my own to show that in selected cases and in a skillful way, genetic testing can also help us to predict which patients are more likely to have certain side effects on certain medications. So we need some skill in being able to choose the right medication for the right patient, depending on which side effects are very important to avoid in that particular patient. And then, like I said, to have a series of strategies that we can use to mitigate this. And we really need to up the training related to that.
Right.
And this is one thing which I've tried to do in my book, is to spell out many different strategies so that the treating clinician has many options that they can use.
Right.
Sometimes 2 or 3 options may have to be used before the side effect can be managed effectively.
Well, I think that's so important. And so basically, if I was to summarize what you're talking about here, you would say the most important parts are education, better education in terms of what effective strategies to take to reduce side effects. And then also it's equally important for clinicians to be sensitive to their patients' side effects and not have an attitude of, well, that's just something that you have to put up with, right? I think that's what I heard you say.
Absolutely.
I think that's great. And where would someone be able to find your book?
So it's available on Amazon.com.
Okay. And what's the title?
It's called Side Effects of Psychotropic Medications.
Okay.
Assessment, Prevention, and Management.
Okay.
My last name is spelled Mago, so if they put in my name, Mago, they'll be able to find it easily. It's very inexpensive, but people have said that they have found it very valuable in being a quick reference to be able to easily access a series of strategies.
That was going to be my next question. So it sounds like you've designed a very efficient way of being able to quickly work on the treatment of side effects and for different types of patients. So I think this is, as we said, a very important topic, and I'd like to thank all of you for tuning in, and I'd like to thank Dr. Mago. And thank you so much for listening to the NEI podcast. We'll see you next time.